Solutions to breastfeeding challenges. Breastfeeding is one of the most natural and beautiful experiences between a mother and her baby. But let's be honest, while it's rewarding, it's not always easy. Many of us face challenges along the way that can make breastfeeding feel overwhelming. If you're feeling frustrated or worried, you're not alone, and more importantly, there are solutions to help you and your baby succeed. In this video, I'll be sharing simple and effective ways to tackle the most common breastfeeding problems, so you can feel confident and relaxed during this special time. Latching problems. One of the most common issues moms face is getting the baby to latch correctly. A poor latch can lead to pain and an inefficient feeding session. To help, make sure both you and your baby are in a comfortable position. Bring the baby to your breast, not the other way around, and make sure they take in a good portion of the areola, not just the nipple. If it's still painful, don't hesitate to ask for help from a lactation consultant. Remember, you don't have to do it alone. Sore or cracked nipples. Soreness is a common issue, especially in the first few weeks. If you're experiencing pain, try using a lanolin cream or your own breast milk to soothe the area. You can also use cold compresses after feeding to reduce discomfort. Make sure your baby is latching properly, as this can often prevent or resolve soreness. Don't push through the pain. It's important to address it early to avoid further issues. Low milk supply. Worried about not producing enough milk? One of the best ways to boost your supply is to nurse frequently, as breastfeeding works on a supply and demand basis. The more your baby nurses, the more milk your body will produce. Stay hydrated, eat a balanced diet, and make sure to get enough rest. If you're still concerned, certain foods and supplements, like oats and fenugreek, can naturally boost milk production. Engorgement. If your breasts feel painfully full or hard, you might be dealing with engorgement. This can happen when your body produces more milk than your baby needs. To relieve it, try expressing a small amount of milk before breastfeeding to soften the breast, making it easier for your baby to latch. Applying warm compresses or taking a warm shower can also help. Blocked milk ducts. A blocked duct can feel like a hard lump in the breast and may cause discomfort. To resolve this, continue breastfeeding or pumping to keep the milk flowing. Massaging the area gently, using warm compresses, and ensuring your baby drains the breast fully during feeding can help open up the duct. If the blockage doesn't clear up or leads to more severe symptoms, contact a healthcare provider. Breast infections, mastitis. Mastitis can be painful and may come with flu-like symptoms. If you suspect an infection, keep breastfeeding or pumping to empty the breast. Apply warm compresses before feeding and cold compresses afterward to reduce swelling. Rest is essential, and if symptoms worsen, see a doctor for possible antibiotics. Breastfeeding is a journey, and like any journey, it comes with challenges. But with the right guidance and support, you can overcome these obstacles and enjoy a fulfilling experience with your baby. Remember, every mom's experience is different, and what works for one might not work for another. So be patient with yourself and don't hesitate to reach out for help if needed. I hope this video has given you some useful tips to make breastfeeding easier. If you found this video helpful, be sure to check out my other videos on baby health and care. You've got this, and I'm here to help every step of the way.